Welcome to the 2018 CBIGG Management Benefits webinar. By now you should have received a benefit guide and 2 enrollment kits for the Sun Life additional benefit offering. During this webinar, I'll be walking through the benefit guide and Sun Life enrollment kits to explain the 2018 Employee Benefits Package. Who is eligible for coverage? All active full-time employees who work at least 30 hours per week or an average of 130 hours per month are eligible for benefits first of the month following 60 days of employment. Also eligible are children to the age of 26, regardless if they're in school or not. Legal spouses and domestic partners are also eligible. Enrollment changes during the year are not allowed unless you have what they call a qualified event. For example, a marriage, a divorce, a birth of a child, maybe your spouse loses coverage through their employer. The date of that event, you have 30 days to let your HR department know of this change, and at that point in time, you're allowed to make any changes to your enrollment. Otherwise, if you wait beyond 30 days, you have to wait until open enrollment next year to make any changes. I'll be going over how to enroll for your benefits, benefit information. We also have a dedicated member service hotline. We call it the Benefit Advocate Center, the BAC. They are available Monday through Friday from 7:30 a.m. to 5:30 p.m. Central Standard Time. If you call or you email them, they are a CBIGG Management Benefits Advocate Center. Therefore, when you call or email, they know exactly who you are, they know all the benefit offerings, and they'll be able to help you for any questions. We also have a benefits website set up, so at any point in time, if you need to pull detailed policy information, phone numbers, web addresses, that information will be uploaded all year. You do have to enroll through Southwestern Payroll, everything benefits. You'll have to create your user ID, which is your first initial of your last name, plus your employee number. Your temporary password is going to be your last 6 digits of your Social Security number. Then at that point in time, they're going to prompt you to create a new password. Once you do that and you log in, you'll be able to enroll step by step. If you have any questions or need any help with enrolling, please feel free to, again, reach out to the Benefit Advocate Sister for assistance. All right, your medical benefits. Both plans are covered through Blue Cross Blue Shield of Texas. For the GAP eligible plan, so I'll explain what GAP means here in a little bit. You have an annual deductible of $6,000 for an individual and $12,000 for family. So if you cover yourself, your spouse, and maybe a few children, the maximum deductible for all of you is going to be $12,000. The out-of-pocket maximum for an individual is $6,350. Family is $12,700. Keep in mind, the deductible is included in that amount, and any copays that you spend for the medical or prescription drugs is all included in that as well. Unlimited lifetime maximum benefit. Primary care physician is a $35 copay. MD Live telehealth is a $25 copay. Network specialist, $50 copay, and all preventive services is covered at 100%. It doesn't cost you any money out of pocket. Emergency room copay is $350. Urgent care copay is a $75 copay. So if it's not life-threatening, find an urgent care within your area, whether it's close to your home, your job, maybe your kid's school. You can go to the urgent care, be in and out a lot quicker than an emergency room, and only pay $75. Now, also keep in mind is there's a lot of these freestanding facilities going up. You may think they're an urgent care, but they're not. They're an actual emergency room. Also, I have heard that maybe from the hours of 8 a.m. to 6 p.m. it's an urgent care, and then thereafter it turns into an emergency room. So just do your research and make sure you find an in-network urgent care. Inpatient hospitalization and outpatient is covered at 100% after you've met your deductible. Diagnostic lab and x-ray, as long as it's performed in the doctor's office and part of the preventive services, is covered at 100%. Now your complex lab and imaging, that's going to be, for example, a PET scan, a CAT scan, an MRI. That's covered at 100% after you've met your deductible. Pharmacy for generic drugs is a $10 copay. Preferred brand is you pay 30% up to a $50 maximum. So any preferred brand prescriptions, you'll never pay more than $50. Non-preferred, 50% up to $100 maximum. And specialty is $60 copay. Now there is a mail order service, so if you're on any kind of maintenance medication, this is a great offer for you to get a 90-day supply for only 2 copays. Now the second plan is HDHP, which stands for High Deductible Health Plan. This is Health Savings Account eligible. How this plan works is you have your annual deductible of $6,000, but you see your out-of-pocket's also $6,000. So once you meet that $6,000, the plan pays 100% going forward for everything, including prescription drugs. There are no copays with this plan. That's why you would set up an HSA account, which I'll go over here in a minute, to save for any out-of-pocket expenses. This plan also has the MD Live telehealth service. It's not a specific copay, but it's a lot cheaper to call them than actually go into a doctor's office. The cost for the MD Live is typically around $45 per visit. HSA Bank. So this is what I was referring to, compatible with the High Deductible Health Plan. So you can set up your own personal savings account. The money can be used for medical, dental, vision, prescription drug expenses. You can contribute pre-tax dollars into this health savings account. The maximum per year for an individual is $3,450, and for a family is $6,900. Now, you don't have to contribute that much. You can contribute $100 a month or whatever the case may be. But this money rolls over year by year, and you'll get a credit debit card that you'll use for any services that you would have to pay out of pocket that would all accumulate to that annual deductible for the medical, just for the medical and prescription drug expenses. As I said before, you can also use it for any vision or any dental out-of-pocket expenses. Telehealth. So on the first plan that I just discussed and the high deductible health plan, this is a great option. They are physicians available 24 hours a day, 7 days a week. You can call them through a 800 number, or you can actually download an app onto your phone. So unless it's something serious where you need to go into a doctor's office, you can use this option. For example, allergies, asthma, maybe cold or flu, or an ear infection. What they do is they'll actually diagnose you over the phone, and they will prescribe a drug sent directly to the pharmacy of your choice. So this is a great option if you have children that are sick at night. You can get some medication before they go to school the next day. Or maybe you're traveling out of the area and you're not familiar where a provider in network may be. So you would either, one, call the 800 number or download the app and do a virtual FaceTime with them. This is the Blue Cross Blue Shield app. This is actually, you can download on your phone, where it shows your member ID card, it shows any explanation of benefits, it shows you access care to your accounts and health savings account as well. So this is a great option to download on your phone in case you need anything on the go. Gap insurance. This is what I was referring to for the first plan. So on the gap insurance, your deductible is $6,000, right? So this is a great option. If you don't have that $6,000 handy and you want to have the security of what if I need to have all that $6,000, this is a great option. It gives you inpatient benefits of $6,000 per covered person. So if you were in the hospital for whatever reason, the GAP plan will pay up to that $6,000. Therefore, your deductible is covered. Also for outpatient benefits, for example, maybe an outpatient surgery visit, it gives you the benefit of $2,500. So therefore, you're not responsible for the full $6,000. It does give you some benefit relief. Dental and vision benefits. So the dental, we have 3 different options for you. The benefits are through Emeritus. You have the low option, the middle, and the high option. So the low option, there is no major services, but this is a great affordable plan if you want the once every 6-month preventive care service, and maybe some basic services, like for example, a filling. The annual maximum on this one is $750. Preventive care is covered at 100%. So once every 6 months, your teeth cleaning, your x-rays, you pay nothing out of pocket. Now the middle plan gets you a little more benefit. So the annual maximum on this one is $1,500. Preventive services, again, covered at 100%. Basic services is covered at 80% after you've met a one-time annual deductible of $50. All right, so then you're responsible for 20, and Emeritus will pay 80%. This one has major services, so this one's covered at 50/50. This one also has orthodontia coverage for a lifetime maximum of $750 for children up until the age of 26. The high plan, if you know you're going to need a lot of services done for this next year, or you have a child that's going to need some braces pretty soon, this would be a great benefit for you. The annual maximum is $3,000. Preventive services still 100%. Basic services covered at 80/20, so you're responsible for 20. Emeritus is responsible for 80. Major services 50/50, but this one has orthodontia coverage of lifetime maximum $1,500. So this one gives you more benefit to go through for any braces. Now the vision is covered through Emeritus, but it's utilizing the VSP network. So if you're going to try and find a provider in the network, when you call or you look up benefits, you're going to click on or tell them you're utilizing the VSP network. Once every 12 months, you can get an exam, and all you do is pay a $10 copay. Lenses you can get once every 12 months, and again, all you pay is a $10 copay. Frames you can get once every 24 months, and you get an allowance of $130. Then anything after or beyond that $130, you get a 20% discount. There is contact lens coverage, but you have to choose either one or the other. You cannot get contacts and frames. There are out-of-network benefits for all plans for medical, dental, and vision, but it's going to cost you a lot more money out of pocket. So what's the point of having coverage if you're going to go to an out-of-network dental or vision or a medical provider? Life and disability. So you do have the option for voluntary life where you can cover yourself, your spouse, and any dependent children. So for yourself, you can get in 10,000 increments to a maximum of $500,000. So if you first become eligible within the 31 days, you can enroll for amounts up to $150,000. So $150,000 is a guaranteed issue for you as the employee. If you want anything beyond the $150,000, you do have to answer some medical questions, and at that point in time, Sun Life Underwriting will review and either approve you or deny you, but at least you know you'll always get the $150,000. Now for a spouse, a guaranteed issue is $50,000. Again, anything over the 50 would have to be eligible or approved by underwriting. Children, guaranteed issue is $10,000. Now keep in mind, $10,000 is per child. So if you have 3 children, that's $30,000 or $10,000 apiece only for one rate a month. Down at the bottom there, it gives you how to calculate or estimate your premium. And at the end of this presentation, or included in your Sun Life enrollment kit, it will have the benefit grid of how much it would cost you depending on the benefit amount that you would like to choose. Short-term disability. So I call this your paycom or your paycheck protection. So you can get short-term disability, which is 60% of your weekly income. It starts on the 15th day of an illness or an accident and lasts all the way for 13 weeks. So you do not have to answer any health questions on this. Now, if you are in the state of New York, California, or New Jersey, you do not need to enroll in short-term disability if you were thinking about doing so, because in those specific states, they have to provide it for you already through the state itself. So having both would not be beneficial because you'll not get more if you choose one or if you choose both. Long-term disability. So a lot of times when the short term ends, the long-term disability kicks in. So if you want to make sure and have a paycheck protection for a while, if you were to become permanently disabled, long-term disability would be a great option to go into effect after your short-term disability. So your long-term disability for an illness or an accident, your waiting period is 3 months. So again, if you choose short-term, when that ends, then the long-term disability kicks in. Now the long-term disability goes all the way up until retirement age. So you can get 60% of your monthly income all the way up to $5,000 as the maximum. So let's just say 60% of your monthly income is $1,000. You don't have to choose the $1,000. You can choose anything up to that $1,000. So you can choose $200 or $300 a month, whatever the case may be. So you don't have to choose the full benefit. Accident and critical illness. So right now, if you are covered through Transamerica or if you're a new employee, these benefits were previously covered through Transamerica. But effective January 1st of 2018, we are moving to Sun Life. Therefore, the voluntary life, voluntary short-term, voluntary long-term disability, we are going to build it all up with the accident and the critical illness as well this year. So the accident benefits, it's like a fee schedule. The great thing about this benefit is if, for example, if you were to break a hip or a knee or ankle, it will either give you $6,000 or $3,000. It pays this money directly to you, no matter how you want to use benefits. So it doesn't get paid to Blue Cross Blue Shield and then they send the money to you. No. If you make a claim, the claim amount will automatically be sent to you to use the funds however you want, whether it's for bills or just any out-of-pocket expenses. So if you'll review in your Sun Life enrollment kit, line by line of what the costs or what the plans would pay, and it keeps going. Now your critical illness, this works a little bit different. So you can purchase a lump sum from $5,000 to $20,000 of coverage in increments of $5,000. Now the guaranteed issue is $20,000. So if you want to purchase $20,000, then you can without having to answer any medical questions. Now you can also enroll your spouse. Guaranteed issue for your spouse is $10,000. But you have to enroll yourself in order to enroll any dependents. Now for your children, guaranteed issue is $5,000 in coverage all the way up until the age of 26. Now there is a great feature with this one. It's a $50 wellness screening benefit each once a year. So if you go in for any kind of wellness exam, pap smear, maybe an annual physical, you send in a copy of your bill to Sun Life and they will send you a check for $50. So when you go through how much the benefits will actually cost for this plan, you'll notice that $50 almost pays for your whole benefit. So the amount that you purchase, whether it's $5, $10, $15, or $20,000, what happens is if you were to have some sort of a critical illness, which is listed here, for example, heart attack, if you choose $10,000 worth of coverage, Sun Life will send you a check for $10,000 if you have a heart attack. Same thing for cancer, stroke, and it just shows you on and on what actual benefits are covered. Payroll deductions. So in your benefit guide, it shows you the payroll deductions for your medical, dental, and vision. So your top plan there, that's the high deductible health plan. That is your HSA eligible plan. So for example, if you're paid semi-monthly, employee only would be $45 a pay period. Now the one underneath it, this is the GAP eligible plan. So this is the PPO plan, GAP eligible. So for example, employee only, semi-monthly is $62.50 per paycheck. Now your dental plans, you have your low, your medium, your high. So depending on which dental plan that you choose, and if you want to cover any of your dependents, those will be your money per paycheck that would be taken out. Then underneath there, this is your vision plan. So if you want to, again, enroll yourself or any dependents, that would be the amount taken out per pay period. So this one here, this is your voluntary life insurance. So when you choose any amount of life insurance, you will automatically have a match of your AD&D. So you would actually look at this graph here at the bottom. So for example, if you want $20,000 in life insurance and you're the age of 45 to 49, it would cost you $3.64. Now notice here, this one says semi-monthly. So if you're paid on a semi-monthly basis, this would be your payroll deduction chart. This is also semi-monthly for your spouse. So if you want maybe $10,000 for your spouse, because your spouse can only elect up to 50% of what you elect. So $10,000, let's just say he or she is 78 cents for $10,000. You also have to go in here and add the 13 cents. Again, this is semi-monthly. Then children under here is semi-monthly. So child life and AD&D, if you want to choose $10,000 and it's one flat rate, no matter how many children you cover, it's $1.04 per paycheck. Now this is the same thing, but it's actually on a weekly basis. So if you're paid weekly, this would be your payroll schedule for an employee. Spouse, same thing, weekly, and child weekly. Now this is your short-term disability. This one here is semi-monthly. So this up here will give you an option to calculate what your 60% would be. And again, you can choose up to the 60, but you can choose anything below the 60. So if you want $350 a week and you're the age of 30, 34, you would pay $9.24 a paycheck. So this one here is the same chart, but it's paid on a weekly basis. Now this one's long-term disability. Again, it has the calculations up here at top. So this is monthly. So you would calculate 60% of your monthly earnings up until a maximum of $5,000 per month. But again, you don't have to choose that full $60,000. You can choose anything below. So for example, semi-monthly pay periods, $800 a month. Your 45 to 49, it would cost you $8.77 a paycheck. Same grid here, but this one's weekly. So if you're paid weekly, this would be your chart. Now this one here, this is included in your Sun Life enrollment kits. The accident plan, for example, if you're paid semi-monthly, if you want to cover yourself and a spouse, it's $7.66 a paycheck. Or if you're paid weekly, $3.67 a paycheck. Underneath here is critical illness. So depending on the amount of coverage that you want to elect and your age band, that would be the amount it would be per paycheck. Underneath here is what it would be for spouse. And then your child for the $5,000 would be, for example, $2.05 per paycheck. So this one here is semi-monthly, and under here is if you're paid weekly. Now your GAP plan, this is the benefit for inpatient hospitalization where you get a $6,000 benefit up to, or $2,500 up to benefit if you're outpatient. So if you're paid semi-monthly, employee only, $36.34 per paycheck if you're between the age of 40-49. If you're paid weekly, employee only, $16.77. As I mentioned in the beginning, we do have the Benefit Advocate Center. Any questions during the year, order ID cards, received a bill and you don't know what it's for, maybe your spouse is having concerns or questions, they can call into or email. They are available Monday through Friday, 7:30 a.m. to 5:30 p.m. If you are having enrollment problems, going online trying to enroll or doesn't know what something means, again, please feel free to reach out to them. They are there to help you. There are also Spanish-speaking agents available. So if you or any of your employees need to speak to someone who only speaks Spanish or can translate, please feel free to contact them.